me. Yeah. Hi, good morning. Please take the your patient. Yeah. Thank you. So this is your patient information form. You're only allowed to read this paper, not the others. Your total time is 1.5 hour. Consultation time maximum half an hour.
Okay.
So now you can start.
Thank you very much. Okay, good morning. Thank you for coming in to being my patient today for my Viva exam. You've met Dr. Lee. My name is Dawn, and Dr. Lee will be my assessor for today. And are you all right with Dr. Lee observing?
Yeah, sure.
Okay, great, no problem. So before we get started, I just wanted to let you know that a consultation and treatment generally takes about 1.5 hours. And because this is an exam that assesses both acupuncture and Chinese herbal medicine, I'll be providing both of these modalities to you today. Does this work in with your plans?
Sure does.
Okay, great, thank you. So is this your first time visiting SITCM Student Clinic?
Yes, it is.
Okay, welcome. And do you have any questions before we get started?
Not yet, no.
Okay, great. So Chinese medicine takes a holistic approach to health, and we believe that each bodily system is interconnected and that every person's situation is unique. So this means that we may need to ask you many questions before we can make a diagnosis. And is it okay for me to start asking you questions now?
Yeah, sure.
Okay, great. So we'll start off by going through your indemnity and release form here, and then your patient information form. The indemnity and release form says that right here, any information that you share with us may be shared with other health professionals to manage your condition. Do you have any concerns about that?
No.
No? And after the consultation, we will also offer you some treatment options. So as with all treatments, acupuncture and herbal medicine may produce side effects. So possible side effects are listed on the form here and include but not limited to minor bleeding or bruising, minor pain or soreness, infection, nausea, vomiting, diarrhea, stuck or bent needles, and in rare situations, perforation of internal organs. Any pre-existing conditions may also cause other adverse events. Do you have any questions about this information?
Those things don't often happen, do they?
No, they don't. No, so don't worry.
Yeah, that's fine.
Okay, great. So the form also says that you may experience any side effects and you may need to report them to us. In rare situations, you may also need to contact someone else. For example, in an emergency, you should call an ambulance. Do you understand this?
Sure do.
Okay. And do you have any questions about this form or anything else before we move on to review the patient information form?
No questions.
Okay, great. So now I'd like to clarify a few things from your patient information form. Any allergies?
Nope.
Okay. Family history?
My mother has had IBS for 20 years.
Okay. Any history of surgical operations or procedures?
I did have an appendectomy when I was 10, but that's it.
Okay. What about history of TCM treatment and or adverse reactions to either acupuncture or herbs?
There have been no adverse reactions. I did get some acupuncture and herbs just to manage my stress levels, but that was when I was finishing my undergrad, so that's like 5 years ago.
All right, great. All good. Okay, thank you. So how can I help you today?
Oh, I have a headache.
Okay, when did it start?
It's been going for 3 months now, and the issue is it just hasn't gone away. It restarted gradually over a couple of weeks, and it's been pretty constant from then until now.
Okay, and where is this pain located?
It's across my whole forehead.
Okay, and does it radiate to any other areas?
Nope, just my whole head. It feels pretty heavy and tired.
Okay, and how would you describe the headache?
Describe it. I guess I just have this dull, heavy pain across my forehead. My eyebrows also feel tense.
Okay, and is it constant or does it come and go?
It is present every day.
Okay, and do you find that the pain varies at different times of the day?
Yeah, It's normally more severe just when I wake up. During the day it's not so bad, but it gets worse again in the afternoon, especially if I'm exhausted.
Okay. And do you know what may have actually caused the headache? For example, was it after an illness, an event, or change in your health or your lifestyle?
There's nothing I can think of. Like I said, it was 3 months ago, so that was the beginning of winter. I'm kind of surprised because I just began a health kick at the end of summer, and I even changed my diet to raw foods because they're healthier.
Right, okay. And have you experienced any headaches before this?
Not much. I've just had a light headache that lasted a few hours every now and then. That's it.
Okay. And what factors aggravate your headache to make it worse? For example, certain foods, cold, heat, change in weather?
Well, it is worse on cold, rainy days. Also after I eat, which is strange because I have salad most days.
Okay. So is there anything that helps to relieve the pain?
Panadol normally takes the edge off. If I'm well rested, it's not so bad either. I think I need a long holiday.
Yes, a holiday would be good. So anyway, you mentioned that the pain changes in severity. So how would you rate the pain today out of a scale of 0 to 10, with 10 being the worst?
Probably a 3 out of 10 now.
Okay. And how would you rate the pain when it's at its worst?
Easily a 6 or 7 out of 10.
How about your eyes and vision? Have you noticed any change?
Well, my eyes feel heavy and tired at the end of each day. And sometimes my eyes are sticky just when I wake up.
Okay, and do they burn or do you notice a discharge?
No, it's nothing too bad. It's just a bit sticky when I wake up, but it disappears after a shower. No pain or anything.
Right, okay, good. And any symptoms related to your ears, hearing, even tinnitus?
I don't think so. Actually, what is tinnitus?
It's a ringing sound in your ears.
No, I don't have that. I think my ears, my hearing are fine.
Okay, great. And do you experience any nasal or sinus symptoms?
Now that you mention it, I do have a stuffy, dripping nose most mornings.
Okay. And what's the color and consistency of the discharge?
Color and consistency. It's clear and watery, and it gets worse when it's raining, like today.
Okay. What about the amount?
It's not a lot. Usually I blow my nose a few times in the morning, and that's about it for the day.
Okay. Do you experience any dizziness?
Sometimes in the morning again, or if I'm tired. The dizziness actually started at the same time as my headache, so it's been going for about 3 months.
Right, okay. And is this dizziness that you mentioned, is it worse when you get up quickly from a sitting or lying down position?
No. It comes and it goes. It's worse when I'm tired, but I don't think it's anything serious.
Okay. Do you feel any stiffness or pain in your neck or shoulders?
My shoulders are really tense and a bit sore. I think it's from the stress. I'm doing my PhD at the moment, and that's obviously challenging.
Yes, no doubt, that's a huge challenge. So how do you respond to that kind of stress?
It's hard. You know, I'm always tired. Headaches make it worse, and then I can't concentrate. I often feel foggy-headed, and I can't think as clearly as I want to.
Yeah, that's not easy, huh? So do you feel aches or pains anywhere else in your body?
No, but my whole body feels heavy and tired. It's hard for me to get up and feel motivated.
Yeah. Okay, so have you sought any medical advice regarding your headache?
Not until now.
Okay. Great. So besides the Panadol, are you treating the headache with anything else?
Well, the Panadol helps, but I don't like to take too much. I do also have regular massages. They can help with the stress.
Okay, good. And do you think the massages help with the headaches?
Yeah, it's just temporary. It's a temporary release, but it comes back normally after a couple of hours.
Okay. And have you had your blood pressure taken recently, or do you have any history of low or high blood pressure?
I had my yearly health check about 6 months ago. My blood pressure then, it was 110/80. I think it's always good.
Okay, yep. Do you have any other symptoms related to your headache?
I do sometimes feel nausea after eating, and that can make my headache worse. Yeah, it can last several hours.
Oh, wow. Yeah. And is it accompanied by vomiting?
No, just the nausea, fortunately.
Okay, good. And any other symptoms that you think might be related to your headache?
None that I can think of.
All right, cool. All right, good. Thank you. So to summarize, your headache came on gradually over a couple of weeks at the start of winter, and then 3 months ago, and shortly after changing your diet to raw foods. The headache has been constant since then with tension along your eyebrows and a heavy dull pain across your forehead. It's worse in the morning when you are tired or in cold, damp weather. And you also mentioned that the headache is worse after eating and can be accompanied with nausea. The only thing that relieves the pain is rest.
And Panadol as well.
Oh yes, of course, yes, and Panadol. All right, so do you mind if I ask a few more questions that are not directly related to your headache, but from a TCM perspective, it will help me better understand how your body is functioning?
Yeah, sure.
Okay, great. Thank you. So you mentioned you experienced nausea after eating, so let's explore that. How's your appetite and digestion?
I often don't feel like eating with this headache. I have lots of bloating after I eat, plus the nausea.
Okay, and can you tell me more about your diet?
My diet's good. Like I mentioned, I stick to raw foods these days, though I sometimes crave chocolate or sugar.
Okay. And how was your appetite and digestion before changing your diet?
I used to have quite a big appetite. I could eat anything, no
Wow.
problems.
Yeah. And so what made you change to the raw food diet?
Like I mentioned, my mother had IBS. I thought it would be a good idea for me to improve my diet. Obviously, I don't want to get IBS in the future. A lot of celebrities swear by this diet thing these days.
Yeah, it's true. It's been gaining momentum. Prevention is always the best medicine. So do you experience any abdominal cramps, pain, any reflux?
Nope, just bloating, and there's an uncomfortable heavy ache in my abdomen, which normally comes after I eat.
Okay. And are your bowel movements regular?
Regular, every day, but a couple of times a week I do get diarrhea.
Okay. And do you notice if any foods in particular trigger the diarrhea, or do you experience the diarrhea at a particular time of the day?
Time of day varies. Yeah, I haven't noticed any foods that trigger it.
Okay. And this diarrhea, is it watery, smelly, or do you notice undigested food in your stools?
It's not watery or smelly. I don't see any undigested food. It's more sticky and loose.
Okay. So, are you thirsty, and how much water would you drink each day?
I don't feel thirsty, but I still carry a water bottle everywhere I go, actually, and so I guess I don't actually finish it. Maybe I could be drinking more.
Yeah. Okay, and do you prefer warm or cold drinks?
Room temperature or warm is good.
Okay, good. And how frequently do you need to urinate, and what is the color of your urine?
I need to go often, every couple of hours. My urine is pale, sometimes slightly yellow first thing in the morning.
Okay. And do you feel hot or cold?
I feel the cold in my hands and feet in the winter, but I rug up, feel okay with that. I don't sweat. It could be because I'm not exercising much at the moment, I just feel too tired.
Okay, yeah. And how would you rate your energy level from 0 to 10, with 10 being the highest?
When I wake up, probably just a 2 out of 10. During the day, up to 5 or 6, but it drops again each night.
Okay. What about your sleep patterns? How many hours a night would you get?
Fall asleep pretty easily. Normally get 7 to 8 hours. Solid sleep, but I still wake up tired.
Okay. And what time do you usually go to bed, and what time do you get up?
Normally go to bed at 11 or 12, get up at 6 or 7 each morning.
Okay. And how would you describe your mood and emotions lately?
Very stressed. Emotionally flat. And I worry too much about the workload with my PhD.
Yeah, that's understandable, of course. Do you smoke or have you smoked in the past?
Nope, never have,
Okay.
and never will.
Okay, good. Do you drink tea, coffee, alcohol?
Do like my tea. I also have a coffee a day, just to energize myself in the morning. Kind of need it at the moment. I have a few drinks socially with my friends, like alcoholic drinks, obviously. That's just when I can find the time to socialize, so it's not very much these days.
Okay. What about exercise? Do you exercise regularly?
I do a bit of swimming, but that's normally just in the summer.
Okay. Great, thank you, Damien. This diet and lifestyle information is very, very helpful. Do you experience any lower back pain and weakness?
Nope.
Okay, thank you. And are there any other symptoms that you would like to mention?
No, I think you've covered everything.
Okay, great, thank you. Now I'd like to conduct a quick physical examination to get a bit more information about your health. So let me measure your blood pressure first, and then I will conduct a palpation, followed by pulse taking and tongue diagnosis. Is that alright?
Yep, sure.
Alright. So, just grab the towels here. So if you could please fold up your sleeve on your right hand all the way up above your elbow. Yep, at least 2 centimeters above. Fantastic. Just place your hand resting it on the towel. Thank you very much. Alright, everything's all good, Damien? It's 110/80. Just keep this. Alright, so all good with your blood pressure test. I'll just now conduct some palpation of your forehead and your neck and shoulders. Okay? Yep. Alright. Alright, so let me know and describe the feeling when I press across and palpate your forehead.
Okay. I feel dull pain.
Okay. Yep. And what about your neck and shoulders?
Yep. Anytime like you're touching between my shoulders or my eyebrows, I feel a dull pain.
Okay, great. Thank you. Alright, so now as I mentioned, feeling the pulse and observing the tongue are an important part of TCM diagnosis. So may I feel your pulse?
Sure. Either hand?
Yes, I'll start off with your right hand first and then your left hand and then both hands together. Okay. Thank you. And your other hand. Take your watch off. Okay, thank you. And now the both hands. Thank you. Okay, thank you very much, Damien.
Nice.
Is it alright if you get Dr. Lee to feel your pulse?
Sure.
Sides, please. Thank you. Thanks, Damien. Alright, and can we please see your tongue?
Yeah.
Alright. Thank you. Okay, Damien, is there anything else that you would like to share or ask before I speak to my supervisor?
Nope.
Okay, thank you. You could maybe go outside and then we'll come back and get you in about 5 minutes.
Sure.
Yeah?